You don't know me. Probably never will.
But I need you to do something for me.
Something that could literally
change everything.
You'll never get a thank you card, and yet I need you to do it.
And if that weren't enough, I need you to do it as soon as you are able to.
If you do this for me,
I'll do it for you.
And for every single person you love.
Deal?
This is our shot to leave COVID behind.
Thank you so much for joining today's session entitled Before Pregnancy, During and Beyond, the Role of Continuous Reproductive Health Care. We have a great panelist with us today. We have also representing the What to Expect project. Joining us is Heidi Murkoff. Also joining us today is Annie Toro. Also with us today as our panelist, Katie Hollingsworth. And also we're welcoming Tejal Patel. Now at this time, let us now receive to the virtual stage, Tejal Patel.
Hi, everyone. Thank you so much for joining. As Teja said, we are going to be presenting today on before pregnancy, during and beyond the role of continuous reproductive health care. So just a quick little overview of what we're going to be covering today. I'm going to go over who we are and what we do at the project. We're going to have our lovely speakers, Heidi and Annie, talk about the continuum of reproductive care. And then we have a special guest speaker, Katie, who's going to talk about one of our programs, What to Expect Basics. So the What to Expect project was founded in 1997. We're a nonprofit organization dedicated to educating, supporting, and empowering moms in need in the US and around the world so that they can expect healthier pregnancies, safer deliveries, healthier babies, and healthier futures. At the What to Expect project, we envision a world where all expecting moms receive the vital evidence-based information and the culturally, linguistically appropriate and community-specific support they need to have a healthy pregnancy and safe delivery. Our whole mom, whole family, whole community approach supports the world's most vulnerable moms before, during, and after pregnancy. So as part of our whole mom approach, we focus on many different areas of the whole person, including intimate partner violence prevention, mental health, obviously the full pregnancy period, and most importantly for today, preconception health. So our impact, the What to Expect project harnesses the power and the global reach of the What to Expect brand, including almost 25 million moms worldwide using the What to Expect app and the What to Expect series books. At the project, we target underserved communities, including moms who are living in poverty, moms who are often underinsured or uninsured, moms who are undocumented, in prison, and moms who are facing public health emergencies. So joining us today, we have Heidi and Annie. Annie Toro is our executive director, and she leads our public health, maternal health initiatives and policy and advocacy initiatives. And I'm also, of course, honored to introduce Heidi Murkoff, the author of the international best-selling What to Expect book series, which have sold more than 42 million copies in over 38 countries, including What to Expect Before You're Expecting, very relevant for today. The creator of the world's leading pregnancy brand, What to Expect, which includes whattoexpect.com, the app, and of course, the founder of our very own What to Expect project. Annie?
All right. Thank you, Tejal. And also, I wanted to thank Claire Lonzeretti on our team. We are so lucky to have just the best team of any organization. We have the dream team, as we like to call ourselves. Not as it relates to me, but the people who are part of my team.
So I want to point out that Tejal ran out and got pregnant just for this event. So that is taking their job above and beyond, doing the field work.
That is absolutely important.
She has the during covered for this. We're going to do the before. She's going to do the during.
Exactly. So, okay, so then let's see if I can compose myself and be able to move forward from there. So as you can see, we're not only a team that works nonstop, but also we love being around each other. And I think that's going to come through within this presentation, aside from clearly being able to get these messages across that are so important for those of you who are joining us today, but also for everybody who will be able to see this after, which we hope will be the case. So I am, on behalf of our organization, I wanted to also, would like to take this opportunity to thank Mayor Bowser and Faith Gibson Howard, who's the executive director for Thrive by 5DC, for convening this summit. We appreciate seeing what DC is doing for moms and babies in the district. And, I have to say, especially as a mom who gave birth in the District of Columbia, it gives me great pride to be able to know that the mayor is leading on these efforts. And I'm really proud to be part of this session. The stakes couldn't be higher, and this summit is incredibly timely. We are so fortunate to have Heidi Murkoff today. Heidi, you're known as the author of the most read and most loved pregnancy book in the world. Every time I tell anybody anything related to what to expect when you're expecting, I cannot have anybody looking at me the same way. It's just I immediately become everybody's best friend.
That's a good thing.
I get the smiles, and it's because it brings them back to a moment in their lives that would never top anything that would mean anything to them in their life. And I know that personally, but I know that's the same for anybody who I've ever talked to, and even the people who we haven't talked to. Everyone knows that your book is actually the longest running title of all time on the New York Times bestseller list, a record that actually still holds. And I've always loved that you describe yourself as a mom on a mission. And to me, that takes a different level, because I get to actually see that in real time every day. Despite all the accolades, all the recognitions you've received since the publication of your first book. And I'm not going to go into those, but we all know what those are, even just having a movie that was inspired by your book.
Oh, no.
Your mission to help moms is the only thing that motivates and drives you. You are a true trailblazer, Heidi, a leader with conviction who's also doing the work on the ground while serving as an inspiring role model to all. Your commitment to public service and to help other moms leaves me speechless every single time. It's like no other I have ever seen in my 25 plus years working on public policy, public health as a lawyer. And to work with you is genuinely and sincerely one of the greatest joys and privileges of my life. Your dedication and service to moms and your energy, genuine and caring nature, and optimism are simply contagious and the backbone of this organization. And I just didn't want to start this question answer kind of non-traditional session without saying that, because I don't get to say it often, and I wanted to make sure that you know that. So with that being said, let's get right to it, okay? So Heidi, let's start you off could you please tell us why the topic of this session is of particular relevance? Why should we focus on ensuring that women receive a continuum of reproductive care to plan what we want to ideally call a healthy pregnancy? Why should we focus on a continuum of care approach in our maternal health advocacy efforts? And I know I jumped, 3 questions I put together there. You can do that in whatever shape or form you like to respond to them. And
I will do that. I feel like it's never too late. Sorry. It's absolutely never too late to get the care that a mom needs. And that could be any time during pregnancy. It's never too early, though. And actually, so much of a baby's future, a pregnancy's health is the clock starts before the beginning. And that's why it's so important to begin before the beginning. I feel like there's sort of always an elephant in the womb, and that's that we don't talk about preconception. We don't talk about the time before that life is created, and it's so pivotal in so many different ways, especially in terms of a mother's health and a father's health, which we're going to talk about later. It's funny because you'd think it was a subject that we could all be on board with, but I remember being at a roundtable with First Lady Michelle Obama and saying, we have to talk about preconception health. We have to talk about, how a baby's health is impacted and a mom's health is impacted and a pregnancy health is impacted before sperm meets egg. And she goes, "You want me to talk about sperm and egg?" Like, yes, actually, I do, because the prelude to that moment is so very, very important. A mom's health, her lifestyle, her mental health, her weight, her nutritional status, the medications that she takes, the medications that, the prenatal vitamin that she might not be taking, all of those things are important at the moment of conception. And that goes for the father as well. So we need to begin before the beginning, and close some of the gaps that keep moms, hopeful moms, wannabe moms, second-time moms, third-time moms, from getting the care they need before that sperm and egg meet, before that life is created.
Wonderful. It's interesting you bring up some of these issues, and they're also relevant. And just the fact that every time you talk about these issues, it's just the mission, of our organization, just based on this and your experience and what you've seen and hear from moms daily, which really focuses our efforts. It's what drives our advocacy. It's hearing from moms directly. And translating, as you do better than anybody, science into language that's actually relevant and respectful, and to moms, and that they can feel empowered by it. This continuum of care also helps us. As I think about it, sometimes, it keeps me up at night more than I like to admit. It's just it really does put women at the center. And that's something that sometimes, we often forget in these conversations, and I think that's also one of the powerful things about the work that you do, Heidi, within our organization as our founder, and how it streamlines what we work on a daily basis, and also, what to expect stands for. It's really having the voice of women be the one that drives it, and just kind of trying to tackle those avoiding the fragmentation of a system that too often we have to face, and try to do something about. As we know, we cannot separate a person from their environment, and this health in all policies approach that a lot of people talk about really needs to be taken into consideration, as you do every time you talk.
And also, she is a woman before she becomes pregnant and after she becomes pregnant. So that's where the continuum of care is so critical. We focus so much on those, 40 weeks, 9 months, give or take. But we need to focus also before and after. So that's where the before, during, and beyond.
Exactly. And after.
And keep that care coming on a continuous loop, so that and that will, of course, take some changes in the healthcare system so that we can close Medicaid gaps, and keep a woman covered before she becomes a mom, when she becomes a mom, and beyond.
That's terrific. Thank you, Heidi. And that was very comprehensive and right on point, clearly, and especially important for this session. So if we go back and kind of take a step back and saying, let's go back to basics, right? And that's not pun intended, given, our program, but, baby basics and, what to expect basics. How would you go back to defining comprehensive preconception care?
So there's a lot. And we do have to talk about family planning. We don't do it enough. We're afraid to talk about it for some reason, but you really can't have the conversation about maternal health, about reducing maternal mortality without that conversation. 50% of pregnancies are unplanned in the US. And, hey, listen, I got knocked up, 3 months after I got married. I didn't see it coming. I wasn't planning. I didn't take a prenatal vitamin. But, had I to do it over again, I would have realized, hopefully known, because hopefully the information would have been accessible to me, which it wasn't at the time, that there are so many steps that you can and should take before conception. Listen, it sneaks up on you sometimes. You can't do anything about that. Carpe pregnancy, when you find out you're pregnant, just, do the best that you can from that moment. But if you have the luxury of time and planning and preparation, that can go such a long way in improving maternal outcomes, in improving a child's health for a lifetime. Again, so much of it is defined before that moment. So there are so many steps you can take. Obviously, taking a prenatal vitamin that contains folic acid, and that goes for dads as well. It means, going and getting a preconception checkup and checking for chronic conditions and diet, weight, because all of those things can impact pregnancy health. A woman who starts pregnancy at a very unhealthy weight is at more risk of complications such as gestational diabetes and hypertension, preeclampsia, preterm birth. So those are steps we can take. Oral health, you're like, oh my God, what does your mouth have to do with your pregnancy health? But in fact, it has a lot to do with it. And if women who have periodontal disease before they become pregnant, that goes untreated, that can in fact is linked to complications during pregnancy. And that important work of getting a woman's mouth healthy with the proper dental care actually does need to begin before conception, because during pregnancy, it's, your mouth takes a hit, you're more likely to get periodontal disease then. But if you get care during pregnancy, it helps you feel better. It helps the condition of your mouth. It helps in terms of, your baby's future dental health, but it doesn't prevent those complications. To prevent those complications, you have to begin before. Things like, exposure to toxins in your workplace, in your home, lead, all of those things can be mitigated ahead of time. Mental health, incredibly important, because those women who have PMDD, who have any kind of history of depression or anxiety disorder, they are far more likely to experience those perinatally. So they might be, we talk a lot about postpartum depression and anxiety, but in fact, those conditions are very common and very pervasive in pregnancy as well. The time to address those is before a woman becomes pregnant. And things like lifestyle habits, smoking, yes, anytime you quit smoking during pregnancy is a good time, but the best time is before you become pregnant. Before, the meter's running, things like substance abuse and, getting more physically active if you're not active, genetic screening, if there's family histories, and, depending on your risk category, and of course, screening for things like not only diabetes and hypertension, but for STIs and HIV, as well as intimate partner violence. You don't want to start a pregnancy with that kind of history. incredibly important to know that intimate partner violence is, if not the leading cause of preventable maternal death, it is right up there. And we have to take that seriously, and addressing it before pregnancy is a really important way of doing that. So, Annie. Preconception care is, and that's just the tip of the iceberg.
I really do think, Heidi, that you've hit on all these just critical issues that we clearly, work on as part of our advocacy work on a daily basis. And as you even filter and hear from moms directly, as you're available 100% of the time for any mom who needs you. And that's something that people don't actually know about, but I'll just make it clear.
Moms send me messages literally every day, direct messages on Instagram, which actually is great, because not only do I get a chance to help them and give them advice, but I get to see what's going on out there. And that was incredibly important actually during the pandemic, when I saw that so many moms were not getting care because of cancellations of appointments. They weren't getting the screenings that they needed. But something I hear from moms, even moms who are planning for pregnancy, even moms who are on the What to Expect app, they got it going on. They are on the TTC boards. TTC, if you don't know, it's trying to conceive. A lot of times they say, well, I just started trying to conceive, and I just started taking a prenatal vitamin. See, that's the thing that we have to plan way out. And by way out, as much as possible, getting women healthy, during their reproductive years, so that they can have healthy pregnancy, and so they can have a healthy future as well. But in fact, you need to take that folic acid well in advance. And if you're TTC, that's already, you could be pregnant tomorrow. Like, you might not be, but you could be. So that means you need to start taking that folic acid ahead of time. And I actually always recommend, there's no harm done in taking a multivitamin that contains folic acid during your whole reproductive life, because you just never know. It's like an insurance policy. Plus, you have better skin and nails, so there's really no downside.
That's true. That's actually something that my mom says on a regular basis, and that's why I every time I hear that, I always think about her, and it just brings me such joy. But it also it's going back to a couple issues. I mean, it's about that support, Heidi, that you provide to moms that we haven't. I mean, you've seen in your career. More times than probably you can even think about, but during the pandemic, as being part of this organization, and how we had to, shift everything we were doing to really look at the moms who were in very desperate situations without any type of help and support. And because of our connections, let's say, we started calling people, and really we're doing casework. Mm-hmm. That is not really a lot of the what is the basis of the work that we do on a regular basis. But I think that it's also coming from your leadership in seeing where are we needed, and if it's to do something for that mom, that is what we're going to do. And that means calling the governor of whoever that we know, or the senator, whoever directly, or a member of Congress, and being able to get that mom that help they need. That's what we did. And we were able to do that successfully. And that is something that I say with such great pride, not for any type of recognition, as I know you would never want that. But it really is what this work it's all about. And that we keep repeating this. And I say it to our team, all the time, that in the end, we're doing this work, but at the end of the day, we're all here to serve moms. And you bring a couple issues, Heidi, that, when we talk about this, because it's not only about the support that you give to moms when they would not even feel comfortable talking about most of these issues with their loved ones because of their fear of being criticized, how they're going to be perceived, the stigma around so many issues, and so many other issues that people are thinking or going through, that we're not a one thing people. There's so much about our lives that is not simplistic in any shape or form. And the fact that 2/3 of pregnancies in this country alone are unwanted. It tells you a lot about the issues that you were raising right now in terms of that folic acid. I even remember having a conversation with my OBGYN, just years and years ago. And I remember asking, when is the best time to start taking folic acid? And I remember, I was relatively, I was still a lawyer, but I was probably my mid-20s or something like that. And they said to me, it was a really good doctor, I will never forget, said, it doesn't matter whether you're thinking of getting pregnant or not. This has nothing to do with it. You have to this is part of your health. And I started looking at this issue so differently, because I think that what happens is that it's all starting to be catered to this wanting to get pregnant or trying to get pregnant, when we all know that most pregnancies are unwanted to begin with. And so if
they're unplanned, most pregnancies are unplanned. About half of pregnancies are unplanned.
About half.
So that's why we need that extra insurance, and to try to get healthy before we get pregnant is really important. And this effort on preconception is actually not new. In 2004, I believe it was, that the CDC started talking. They issued their first report on preconception health and the importance of it. And it was at that point, and I spoke to them about that then, and it was at that point I started to realize how important this was in the big picture of maternal health. But here we are in 2021, and we are still not talking about it. And that's an issue. I think the pandemic has added other concerns, presented other barriers, in that, family planning was no longer as accessible as it was. So, the idea of even getting pregnancy care, that was more difficult to do, never mind preconception care. So that's why this is a really important time to reset on preconception care, which should be a major priority for us.
I really love the way that you addressed that. And you did talk about issues of intimate partner violence, which we've seen in the pandemic, skyrocket in ways that are really scary, more than alarming.
And there are solutions to that. There
are. And
we have to talk about it. We have to talk about mental health. We have to talk about intimate partner violence. We have to talk about family planning, contraception. We have to talk about all these things. We can't just sit back and hope everything, fingers crossed, everything's going to go well.
Well, and that goes back to our issue of how the mission of our organization, and you're wanting to think about women within a continuum of care, from preconception until the way postpartum. And so which is, why we look at a whole woman approach and to health, not looking at things in fragmentation. And this issue of mental health that you raise is so important. And, we see it in the US, we also see it overseas in a way. I mean, there's a big conference, last week, and clearly there was a maternal mental health week that has been commemorated and was able to raise some awareness about these issues. But sometimes that concerns me from the standpoint that even in thinking about moms or moms to be, or women in general, being able to talk about these issues before they get pregnant, because they're just so afraid to even talk about it at any point whatsoever, let alone if they find themselves pregnant.
That's why screening is so vitally important, but you don't get screening. Unfortunately, most women don't get screening under the best of circumstances, but it really should happen preconception. If you're not getting preconception care, if you don't even qualify for care of any kind, that's an issue. That's why I always emphasize, the ACA was awesome, great, improved access to care in a lot of ways, expanded Medicaid in some but not all states. But one thing it didn't do is make pregnancy or preconception, for that matter, a life qualifying event. So delivering a baby is, yeah, you can get health insurance under the ACA if you have a baby, but not once you're pregnant, unless you're in special enrollment period. So that's why I've always been saying, get healthy before you get pregnant, get covered before you get pregnant. It's so incredibly important. And to do that, of course, Medicaid will have to do a lot of expanding, not just of, qualifying, but in terms of the time when a woman can access care. It shouldn't wait until, her pregnancy is confirmed.
Exactly. No. And it's one of the issues it's one of the issues, Heidi, that you've been working on since the onset and trying to, drive forward, not only at the federal level, but also at the state level, because it just depends on where you live. And I mean, again, so much of our circumstances depend on where we live, right? But I mean, the fact that this happens.
The color of our skin, where we live, what we can afford, that's unacceptable. It's unacceptable. And that's why we have, there are no easy fixes for our crisis of maternal mortality, which is, hitting communities of color, especially Black moms and Indigenous moms, hardest of all, but it's also impacting, let's face it, we have among rural moms, we have a terribly high, no matter, whether they're Black or white, Black moms have a much higher rate of risk, but rural moms as well. We just don't have access to care. That's got to change.
Maternity deserts, which we deal with on a regular basis.
And now let's call them preconception deserts, because that's what they are.
Exactly.
Women covered.
This is, there's so much here. And when you talk about screening, even, I think about issues of IPV, right? Like, we see the work that we do globally. Also, when we do a lot of integration work, that's when, a real opportunity to be able to get a woman at a place where we can get her screened for certain things, the kid immunized, and do all these things. But sometimes we don't have the ability to even to do that here. And that's, we really need to change that. And I think about issues of IPV, where you can have a woman be able to talk about something about getting her immunizations and then get her at a place where she can be screened in a way that's discreet, and also allow her a place to be able to safely talk to someone who can refer them to services that can save their lives. Exactly. So I think it goes, your issues, the points that you have highlighted couldn't be more timely and critical.
The slide we're seeing now, why should preconception care be a priority?
Exactly.
We know the science. We know that, having a healthy mom and a healthy father at that moment of conception reduces maternal infant mortality, prevents complications during pregnancy and delivery, prevents stillbirths, preterm birth, low birth weight. All of those serious pregnancy complications can potentially be prevented with the right care. And let's face it, the ultimate in preventive care is preconception care. I always say maternal health care is the foundation of all healthcare, but the foundation of that is preconception health. We need, for a healthy woman to be able to plan a healthy pregnancy and a healthy baby with a healthy future, when and if she chooses to do that, by the way, which is an important point. Yeah. So all of those things align. And like I said before, you can't have this conversation about reducing maternal mortality, about improving outcomes, without talking about taking those preconception steps and making it easy for more women to be able to do that.
And I'm really honored, to always clearly work with you on a daily basis, Heidi, to be able to bring these issues to the limelight, because what we end up doing is talking about all these issues in isolation. And then we're just not really actually, it's like putting band-aids on different things and then not addressing issues that really are tackling the most urgent things that we need to do for moms.
Well, and that's because we need to take a holistic approach.
We do.
And, legislation like the Momnibus is great because it does tackle so many of those social determinants of health and, access to healthcare. But we need to talk about it all together and make it happen all together, because all of the parts need to be in place. All the pieces of the puzzle are needed to create a healthy pregnancy and a healthy baby with a healthy future and a healthy mom with a healthy future. Because some of the risks are, we know that babies who are conceived when a mom isn't healthy are more likely later on in life to have type 2 diabetes and cardiovascular disease. But the same goes for the mom. If she develops complications of pregnancy while she's expecting, she is at higher risk for serious chronic health conditions later in life, such as hypertension, such as type 2 diabetes. So we need to be mindful of that. This being the ultimate in preventive care also means that it's the ultimate in cost effectiveness. Like this is like you just provide this little bit of care before a woman conceives and you save exponentially for her lifetime and for her child's lifetime. So, plus a healthy mom and a healthy baby, that's priceless. So we've got cost savings and we've got a priceless outcome. How can we do better than that?
Yeah.
It's such a small investment. All of these interventions to prevent maternal mortality are small investments with huge, huge yields. Let's not forget that.
I think that, you've hit always on so many important subjects, and as you work so closely with legislators at the federal, state, local level, different agencies, globally, multilaterals, everybody that you're engaged with on a regular basis. I mean, we keep going back to this issue of return on investment, right? Because there's no better investment than being able to look at these issues at the time that it's supposed to, and still, even in the collaboration and the work that you've done tirelessly around the Momnibus, that you've been engaged, day in, day out, and so every single provision of the Momnibus, working on the House and the Senate and everybody else. And pushing this forward and every single legislation that's out there affecting maternal health, you're actively engaged on and providing the information that's needed, the actual technical information that's needed, but also making sure that it's comprehensive, that we're not leaving any mom behind, and that's something that we're clearly celebrating in light of some recent developments, but also we have a lot more to do. And, and your work in that space on advancing the Momnibus, every day, and all those provisions has been incredible, but also everything else that you do.
And we do have to work on Medicaid expansion, on covering all women during all times of their reproductive life. Of course, every person should be covered all the time anyway. That just makes common sense, and it lowers healthcare costs. We could have a much healthier society if we did that. But we saw, a study in Georgia where as soon as access to family planning, to contraception, to being able to get those visits, as soon as that's gone, maternal mortality increases.
Yeah.
It's not rocket science. No. It's just a fact that when women don't get that care, they're more likely to die, during pregnancy, postpartum, during delivery. Their children are at greater risk. They're at greater risk. So this is pretty simple. We need to expand Medicaid in so many different ways. But we need to close that gap and make sure that a woman can access preconception care no matter where she lives.
Yeah. Reimbursement issues.
Stop talking about it. Stop talking about it. It's a controversial topic. It's not.
Yeah. No, and reimbursement issues.
Like
you can't
said,
talk
elephant
about
in the
issues.
womb. Elephant in the womb. We have. I mean, I can't take credit for that. I wish I could, but it's something we really, really need to talk about openly. Not be afraid to say things, about family planning. Not being afraid to go there, because it does impact maternal health in a super significant way.
Yeah. And also we clearly need to talk about reimbursement issues and what a real deterrent that is in being able to help moms that we need. In shifting gears a bit, I wanted us to talk about the engagement of fathers and partners prior to pregnancy, which is so critical. But also, and before we do that, we can briefly, because I wanted to make sure that before, we conclude, I don't want to miss an opportunity, Heidi, especially because so much of the work that we've been doing has shifted tremendously given what we're seeing in terms of a lot of vaccine hesitancy, even resistance, among pregnant women and those planning pregnancy. Can you briefly tell us why and what can we do about this? This is too important. We've dedicated a lot of work. You're working on that day in and day out. And before we move into the next slide, I want you to please briefly, bring this up or share whatever you think is about.
Please. Maternal vaccines. And over the last 2 weeks, I've had in-depth conversations with Dr. Fauci and just yesterday or day before yesterday with Dr. Walensky of the CDC, because this is critical at this moment. There is an urgent need to get information out to pregnant women and couples who are considering pregnancy, breastfeeding moms, everybody, that they need to get vaccinated. COVID vaccination, flu, we can talk about it another time. That's also critically important, and you can get your flu shot and your COVID shot at the same time. Got that cleared with Dr. Walensky. So that's good news. But the vaccination rates for pregnant women at this moment are hovering just over 25%. And the risks for a woman during pregnancy, according to really recent research, risk of COVID, they face like an 11 times greater risk of dying from COVID if they are pregnant. They face a far greater risk of being hospitalized, of being intubated, of stillbirth, and yet we're not speaking loudly enough about that. I think I always start with the premise. I think everyone in public health should start with the premise that every parent wants the best for their baby. Every parent wants to keep their baby healthy and safe. And I totally get it. You watch every substance that you put in your body when you're pregnant. Your body's a temple. Well, so of course people are having concerns about the vaccine, and it's relatively new. But Dr. Walensky, Dr. Fauci both, reassured me and What to Expect moms that the risks of COVID are so great during pregnancy, and there are no significant proven risks of the vaccine. There's been lots and lots of studies. We know that these are safe and effective, and the risk benefit equation weighs heavily on benefit. The other thing that they're hearing a lot, and that I'm hearing a lot, that we're hearing a lot on What to Expect, is the concern, and this is relevant to the preconception conversation, is that somehow getting the mRNA vaccine impacts your DNA, and that it impedes your fertility, whether you're a woman or a man. This is completely false. This is not true. Like I said to Dr. Fauci, let's not shoot the messenger. It's just messenger RNA. It's just sending a message. It is not infiltrating. So this is really important message to get across to everybody out there. Everybody, especially, Black moms are vaccinated at a far lower rate. We understand all of the issues at play, but they are at greater risk because of pre-existing conditions. We have to make sure that moms, wannabe moms, dads, everybody, because we're going to have to cocoon the baby as well. And there will be some antibodies if you get the vaccine late in pregnancy or if you get it while you're breastfeeding. But you definitely need to cocoon that baby and cocoon yourself, keep yourself safe. Let's, any preventable, any maternal death is tragic, heartbreaking, but any preventable death should be considered unacceptable. I say that all the time, but it really relates to COVID as well.
Yeah.
So flu vaccine, Tdap vaccine, the rates are really, really low, and we must change that.
And thank you for being a leader in making sure that issue becomes the priority it needs to be. We've, as I mentioned before, we've shifted our priorities to make sure that this comes to the level that it really needs and deserves.
There has to be more awareness, and there has to be.
It needs to be.
And providers have to engage in this conversation.
Completely.
Yeah.
Completely. Thank you. And fortunately, through our coalitions and engagements, we're going to continue to do that. But there's a lot to be done in that space, and I appreciate your addressing that question, for us and the people who are a part of this panel. So, just moving on the engaging of the fathers and partners, prior to pregnancy. Can you tell us why that's so important? Why is that so critical?
It's so important in so many different ways. Just from from a support perspective, that fathers, when fathers are supportive, their outcomes are better because they're encouraging their partners to get healthcare, to eat well, to exercise, I love the Hear Her campaign that the CDC has been doing for one reason, because it engages the entire family, especially the partner. Hear Her, we're talking about healthcare providers, but we're also talking about partners. Listen to her when she speaks up, advocate for her. When fathers advocate for their partners, whether it's during pregnancy or it's during delivery or postpartum, we have much better results. But even just from, the sperm and egg, sorry that I keep doing this, but sperm and egg perspective, a father's health at conception is impactful on the health of that child. That's really important to know. We usually think, they're just donating a sperm, but the quality of that sperm actually does matter, and the health of that father. So there have been studies, very recent studies, showing that if a father is overweight, if he smokes, if he's got diabetes, hypertension, any kind of chronic disease that could impact the health of his, not only impact his fertility, because, well, that's one thing. It's hard to get pregnant if you have some of these conditions, but also impacts the child's health. So there's a higher risk of complications during pregnancy. There's a higher risk of preterm birth, a higher risk of miscarriage, a higher risk of stillbirth when a father has several of those risk factors. So getting dads healthy, first of all, getting them both at a preconception appointment, if you can, that's the best place to start. So they both start taking folate, because that's important. That can help when a dad is deficient in folate. The risk of those neural tube defects exists, from him as well. His smoking impacts it. His use of drugs. So it's really important to engage mother and father, both partners, in this conversation before at that preconception appointment.
That's wonderful.
Yeah, so incredibly important. And what happens if you do that? Then they're not just like on the outside looking in. So we at the project, I always have advocated for engagement throughout a pregnancy, making fathers feel like they are part of the conversation. One of the things I love about centering health, which is a great model of group care, is that it includes fathers when there are fathers to include, or partners when there are partners to include. That's important because what I've noticed in those kinds of settings is that fathers actually ask as many, if not more, questions. And if we let them ask the questions, they become more and more engaged in the process. This is a way of starting, the more they know about the importance of breastfeeding, the more supportive they'll be. And it becomes, team baby. We're all on the same team.
Yeah.
And a good team has a great provider or providers. It's also got both partners if there are two partners. If there aren't, bring in someone else, because no mom should stand alone. But if there are two partners, both of them should be engaged and made to feel like they're a part of the process, not a spectator. And when you do that kind of thing, not only, do you encourage bonding, not just between the dad and the baby, because they felt part of the process from the very beginning, before the beginning, but also between the partners. This is like becomes a three-way, which is a really sweet kind of three-way. And they all, all bond together, which is really important.
And it's a connection. I mean, it's not only about the connection, but it's also about the fact that you can have a partner who is able to see things that perhaps you might not, and can support you if it's through mental health issues, or even issues of breastfeeding, which are so incredibly stigmatized. I think that there's a lot of shame around those issues. So I think that the number of ways in which either fathers or partners in any capacity can be there for moms is incredible.
And the research shows that when a father is supportive of breastfeeding, for one thing, breastfeeding is far more likely to succeed. It takes a village. It takes, a village of support, but part of that village is your partner. When partners are not supportive, breastfeeding is not likely to succeed. And that's a shame. That's why one of the many reasons we have to include them on that team. And something else I always feel is important to point out is that if partners are engaged in this process, then we are raising a nurturing generation. We need to change the perception that moms are the nurturers. That's just not true. Men, just like women, produce oxytocin. Their hormones change during pregnancy and postpartum, so that they produce less testosterone, which is the aggressive hormone, and more estrogen. And so it brings out the nurturer of the male of the species, but it is there. It is there biologically, and we have to stop denying that and stop, when there's a father in the picture, engage him. Because if we have nurturing, this goes, we need to raise a
nurturing boys.
Nurturing boys who become nurturing men, and who become nurturing fathers. And that is the best way. It's the best way of breaking the cycle of not only detachment, neglect, but of intimate partner violence and child abuse.
Completely. I want to go. Oh, absolutely. Of course. Exactly. I want to go back to some of the barriers, about preconception care. But before doing that, in the interest of time, I want to make sure also that we have a moment to be able to turn it over to Tejo for a second, so that she can introduce one of our partners of our basics program, who's joining us for this, which we're really excited to have Katie here from, Community Action Partnership of San Luis Obispo, who's a great partner for our basics program and overall. So I just wanted to turn it over to Tejo for a few seconds, and then come back to Heidi in our closing in terms of barriers to preconception care, and how can we utilize health literacy as a tool in our preconception care before we end?
Thanks,
Tejo.
Annie. This is actually a great transition point because we did have a question from the audience. Someone asked, do you have recommendations for improving preconception care in the district? We have already expanded Medicaid. So I think to answer your question, what we're going to be talking a little bit about today is, well, how can health literacy address preconception? And so here's a fun quote from Heidi. Knowledge is power. It's especially powerful when you're pregnant, a new mom, or you're planning for a pregnancy. And what this means is what we've embodied at the project is a program called the What to Expect Basics, which is a program that helps moms follow month by month with their pregnancy. We provide them this easy to follow pregnancy book, which addresses social, economic, cultural, and educational challenges faced by millions of moms everywhere. In addition to providing them this month-by-month guide, we also have a Moms Club. And this provides moms the opportunity to share their experiences with other moms. They can get the support they need while also making sure that they're getting the evidence-based information from their provider. And it's really meant to empower moms to be able to ask the questions that they need to ask to their providers, right? We want to make sure that they know and they're armed with the questions and the information ready to make the decisions they need to. The final component of our What to Expect Basics is a health literacy training. So as we talked about earlier, we're all about the whole mom, whole person, whole community approach. And our perspective of continuum care means that we have to include providers at the table. And that means training providers on what health literacy is, so that way they can communicate with moms the prenatal education that moms need. So joining us today from actually one of our on-the-ground programs is Katie Hollingsworth from CAPSLO in California. She's going to talk a little bit about what her organization does, how Basics is included, and then Heidi and Annie will be asking her some questions on what does preconception look like in a health literacy program on the ground. Katie?
Hi, everyone. Thanks for having me. This is a huge honor. Can you hear me okay?
Yeah,
we can.
Wonderful.
Welcome, Katie.
Welcome.
It's so wonderful to have you.
Thank you so much. Well, I'll just jump right in. So Community Action Partnership of San Luis Obispo, we serve thousands of families in 10 counties in the state of California. And community action agencies were born out of the Johnson administration through the war on poverty. And my specific part, my specific role at CAPSLO is we have Head Start, Early Head Start, and Migrant and Seasonal Head Start. And we serve 5,000 children in the state. We also serve about 50 expectant families within our service area, and we use Baby Basics as our curriculum for our education and health literacy with those families. And we also have part of our 5-year long-range goal for Head Start and Early Head Start is to increase health literacy in our families, and we utilize Baby Basics for that. Wow. And part of preconception care that we kind of said, how are we going to make this better? How are we going to grab families from the very beginning? And so we ask at application with the health history for the child, we ask about mom's health, and we say, are you planning on growing your family, or are you pregnant now? Are you interested in this service? So that is from the beginning, we're trying to target our families because they all meet federal poverty guidelines. They're all underserved. And many of them are living in food deserts. Many of them need tons of education, and we want the best for them. So that's why we use Baby Basics.
That's so great, Katie. And especially that you're asking that very important question, are you planning to grow your family? Because, globally, I've seen that, people will talk, you can't really get family planning going before the first pregnancy, but you can after that, postpartum with you can set them up for contraception and family planning success. But if you don't ask the question at all, which is the problem, and I think the member of the audience who asked about that, it's really important that providers are starting that conversation. that, that they're not afraid to ask a woman who comes in for her annual, or a woman who comes in with a UTI or whatever she comes in for, to ask whether she has any of those plans. Maybe it's a little awkward, but this is the only way that we can break through and provide that care. The other component, of course, is that knowledge, awareness campaigns, making it clear that this kind of service is out there for you to take advantage of, and that it can greatly impact the health of your baby. So I think that's awesome that you're doing that, Katie. And I know we're almost out of time, but
I know. Yeah. So I mean, wonderful. I mean, Katie, we there's a lot of follow-up that we need to do directly. We're just so proud to be your partner. Thank you for what you're doing in California. And we will be following up with you very, very soon on how to scale up, especially at a moment when we're revamping this program to actually serve more moms and being more targeted about who are the moms who need our help at this particular moment. So we're honored to be partnering with you and look forward to expanding and working more closer together with you. Thank you for being part and making the time to be with us today.
And when I talk, thank you so much, Katie. When we talk about empowerment, it's that information, but also feeling comfortable asking questions. Mm-hmm. I mean, if you don't know what you don't know, but you don't know if you don't ask, but you don't know what to ask unless someone opens those conversations for you. So part of the basics program is, suggesting and encouraging questions instead of just saying, okay, you have any questions? Our training asks, people to start thinking more in terms of, do you have this specific question? Mm-hmm. Because otherwise she's going to sit there, if she has never been in the empowerment business before, she's going to sit there and just look down. And shake her head because she doesn't know what to ask. You don't know what to ask if you don't know what to ask. So anyway, it's really important part of what. And
this is why this program is here. Why why Heidi started it, 15 years ago. While we're ramping it, it's really, really important. We wanted to get to the main barriers to preconception care, but since this presentation is going to be shared by our team widely. And we know we're running out of time. We have so much to say and so much that we couldn't even get to. But we're equally, again, so proud and honored to have had Heidi. Thank you again for making the time to be with us with everything else you have going on.
There's nothing I'd rather do, but I also want everybody to connect with us at Heidi Markoff at What to Expect Project, What to Expect. And ask those questions that you have and share your insights, because we can't do this alone, but we can do it together.
And we are big on that. This is how we work. As we can see from our community of moms, it's all about bringing the voice of moms and giving them the information that's going to give them the empowerment to be their best advocates. And we're here for you. And we will be able to address some of the questions on barriers to preconception care, whatever other questions that came out of this discussion. And it's so wonderful to be able to end with Heidi's quote, one of the many wonderful quotes that are inspiring to me personally. And I see it every day of my life of how these words really take a true meaning for all of us, sometimes even particularly more so than others. And it takes a village to raise a child, but first that village must safely deliver a healthy baby to a healthy mom. So Thank you, Heidi Markoff, for those words that have been a really important, inspiring words for me, for all of us, for so many moms. And thank you again for the work you do and for your commitment. And thank you for being around us and to be our founder.
All of you who provide care and care about moms and babies.
Thank you.
All I got.
Thank you. Thanks, everybody. And thanks for being here. Thank you again, Tejo and Claire and everybody on our team.
Bye,
and everybody else. Bye.
Yeah.
Thank you.